Now, in our fifth and final section of the lecture, acute and chronic inflammation of the larynx, let's discuss some other common inflammatory conditions in which the larynx can become involved. These conditions will be the tuberculosis and the lupus, and also syphilis and leprosy of the larynx, scleroma of the larynx, and then laryngeal mycosis, which are the fungal infections that can involve the larynx. So first, tuberculosis of the larynx. The tuberculosis is the main, pulmonary tuberculosis is the most common tuberculosis, and then usually this spread to the larynx. So it's secondary to the pulmonary tuberculosis. And then tubercle bacilli reaches the larynx. So tuberculosis is the infection of the lungs, mainly in most cases. And then from there it spread to the different parts of the body. So when the tuberculin bacillus or reach the larynx, it can cause tuberculosis of the larynx. Symptoms and signs are the weakness of voice, hoarseness, ulceration in the larynx, severe pain radiating to ears, and there is swallowing is painful with marked dysphagia later on. So any patient who has a history of tuberculosis of the lungs, when they present with these symptoms and signs, the idea or the first thing that you should pay attention to, that it might be the tuberculosis of the larynx that is present. So weakness of the voice, hoarseness, ulceration, pain radiating to the ear, and dysphagia is present. Pathology is tubercle bacilli penetrates the laryngeal mucosa, submucosal tubercles and ulceration develops. So once the bacilli enters the laryngeal mucosa, it leads to the formation of tubercles and ulceration. Red and swollen mucosa. Parts affected are interarytenoid fold first, ventricular bands, vocal cords, and epiglottis. So all these areas are affected slowly as a result of tuberculin bacillus that enters the laryngeal mucosa. Laryngeal examination shows there is hyperemia of vocal cords, swelling in interarytenoid region, ulceration of vocal cords, ragged ulceration on arytenoids, granulation tissue in interarytenoid region, turban epiglottis, swelling of ventricular bands and airy epiglottic folds, and then pallor of surrounding mucosa. All these are the features present on examination. There is ulceration, then there is granulation tissue. As a result of these ulcerations caused by these systemic diseases like tuberculosis, they can lead to the granulation formation. Then there is swelling of the ventricular bands, epiglottic folds, and then there is a condition or the feature of the epiglottis known as the turban epiglottis is present. Diagnosis and treatment is X-ray chest, sputum examination, biopsy of laryngeal lesion. Same as the pulmonary tuberculosis, treatment is by anti-tuberculin drugs. Anti-tuberculin medicines are effective now if the treatment is continued for the full course, then usually the recovery is very, very good. Next condition is the lupus of the larynx. It is an indolent tubercular infection associated with lupus of the nose and pharynx, involve anterior part of the larynx. Epiglottis is involved first, and then it can spread to airy epiglottic folds and ventricular bands. So it's the infection caused by the associated with the lupus of the nose and pharynx that can spread to the larynx also. Treatment is anti-tubercular drugs. Prognosis is good. Syphilis of the larynx. It's a rare condition, occur in any part of the larynx, present as smooth swelling which later ulcerate. So initially there is smooth swelling of the larynx, any part of the larynx, but later on there is ulceration present. Laryngeal stenosis develop, which is a frequent complication. Diagnosis is by biopsy and serological tests. Then the leprosy of the larynx, another condition, rare condition again. These are not very common conditions. Most common can be, we can say, is the tuberculosis. Tuberculosis is again at the rise now because of increased patients with the AIDS, and the tuberculosis is again at rise. So tuberculosis larynx can be one of the most common type of infection that can occur. Rare condition and is often associated with leprosy of the skin and nose. It presents as diffuse nodular infiltration of epiglottis, airy epiglottis fold, and arytenoids. Lesions of the leprosy also may ulcerate, associated with nasal leprosy. So all these conditions are not only affecting the larynx, usually associated with the nasal infections and the pharyngeal infections. End results after healing, there is deformity of laryngeal inlet and there is stenosis present after the leprosy of the larynx. Diagnosis is a biopsy from the lesion. Next, scleroma of the larynx, chronic inflammatory condition caused by Klebsiella rhinoscleromatis. Laryngeal involvement may be seen occasionally with or without a nasal lesion. Clinical presentations are smooth red swelling in subglottic region, hoarseness of voice, wheezing, dyspnea, and nasal lesions. So that's the scleroma of the larynx caused by Klebsiella rhinoscleromatis. Diagnosis and treatment is by biopsy. Diagnosis is done. Treatment is streptomycin or tetracycline, combination with steroids and reconstructive surgery because of the nodular formation that can cause ulceration and different things. Reconstructive surgery is important. Laryngeal mycosis or fungal infection of the larynx rarely affect larynx. The common fungi that can be the cause candidiasis, histoplasmosis, and blastomycosis. Diagnosis is by biopsy. And finding similar lesion in other body parts is important. So that was all about these different inflammatory conditions like tuberculosis, lupus, syphilis, leprosy, and scleroma of the larynx, and how we can manage and treat these conditions. Thank you for watching sqadia.com.